Welcome back. In health matters, it may be getting warmer outside, but the flu is still circulating in Vermont and all across the country.
In fact, the CDC says this year is a record-long flu season. Local 22's Courtney Kramer spoke with an epidemiologist at the health department. Courtney is joining us now. Courtney, I thought last year was bad, but we're learning some more information.
Yes, good evening, Glenn and Lauren. There have been 21 straight weeks of elevated flu activity. That's 1 week more than the previous high of 20 weeks back in 2014, and the longest season since the CDC started tracking it more than 20 years ago. But while it may be the longest stretch of flu activity, it doesn't mean the flu was necessarily severe. Jennifer Pistol, an infectious disease epidemiologist at the Vermont Health Department, said in terms of severity, this was a typical season in Vermont with less hospitalizations than last flu season, which was the deadliest in 4 decades. She said the season started out with the strain H1N1, and halfway through the season, a second wave of flu, H3N2, became more prominent. Pistol says that strain is more severe, especially in people over 65. The good news, the number of positive cases is going down.
There is still flu out there, and especially within Vermont, that we are still getting positive flu tests back from our state lab, but we're starting to see a decrease in general. So I think that's important to remember, that while it's above baseline, it's been above baseline for 21 weeks, that has been decreasing.
While the flu is still lingering, Pistol said it's important for people to stay home if they're sick and to continue washing their hands. Live in studio, Courtney Kramer, Local 22 News.